Hello everyone. Our today's topic of discussion is cell injury. So basically cell injury is divided into the four types: reversible, irreversible cell injury, endoplasmic reticulum stress, and free radical injury. So cell injury. Cell injury has four types: reversible cell injury, second type is irreversible cell injury, third type is endoplasmic reticulum stress, and fourth type is free radical injury. So in first type we are going to discuss about the reversible cell injury. Reversible cell injury में क्या होता है? So reversible cell injury. In reversible cell injury, when injurious stimulus is removed, तो क्या हो जाएगा? सेल जो है अपनी प्रीवियस स्टेट में वापस जा सकती है, तो वो होती है रिवर्सिबल टाइप ऑफ सेल इंजरी. When stimulus is removed, cell can go back to its original state. Cell can go back to its original state. So, in reversible cell injury, when injurious stimulus is removed, then the cell will go back to its original state. So, what is the mechanism of this? We are going to discuss. So, mechanism of reversible cell injury. Mechanism. Basically, in any kind of cell injury, the basic mechanism is related to the hypoxia or low oxygen tension. So, hypoxia. Decreased oxygen level will lead to hypoxia. Due to hypoxia, what will happen in mitochondria? So, this will lead to mitochondrial dysfunction. This is our mitochondria. In mitochondria, there will be some dysfunction like less production of ATP. So, ATP production will be reduced in the mitochondria. So, reduction in the ATP production. ATP production. So, due to reduction in the ATP production, we can see three type of conditions here. The first condition is sodium potassium ATPase pump. So, this is our sodium potassium ATPase pump. Sodium potassium ATPase. So what is the functioning of the sodium potassium ATPase? Basically the functioning is to depend on the movement of sodium and potassium. So it will throw out the 3 sodium and get back to potassium in exchange of 3 sodium. So due to less production of the ATP, what will happen? There will be less activity of the sodium potassium ATPase. So reduce activity of sodium potassium ATPase. So sodium potassium ATPase will function less. So जब sodium potassium ATPase की functioning कम होगी, तो what will happen? See, there will be more influx of sodium and water. Increase sodium and water influx inside the cell. So more sodium and water will enter inside the cell. This will lead to hydropic changes or swelling of the cell. So swelling या फिर हाँ swelling or hydropic changes inside the cell. Hydropic changes. This is also known as cloudy change. Cloudy change. So this was the mechanism which is shown on the screen. So what is the next mechanism? We are going to discuss about the next mechanism. So due to increase anaerobic glycolysis, more lactic acid production will occur and this will lead to the lactic acidosis. So more anaerobic glycolysis, it will lead to increased lactic acidosis. So due to lactic acidosis, what will happen? There will be reduction in the pH. So in pH reduction, what will happen? The clumping of the nuclear material will happen. So what will happen due to decreased pH, mean acidic nature? This will lead to the clumping of nuclear material. Clumping of nuclear chromatin. So न्यूक्लियर क्रोमेटिन क्या हो जाएगा, उसकी क्लम्पिंग हो जाएगी. In next stage, we can see the detachment of the ribosome from rough endoplasmic reticulum. So there will be detachment of the ribosome from the rough endoplasmic reticulum. So our next step is detachment of ribosomes from rough endoplasmic reticulum. So due to detachment of the rough endoplasmic reticulum from ribosomes, what will happen? This will lead to the increased production of lipid. Increase lipid production. This is known as fatty change. Fatty change. And on another stage, what will happen? There will be less protein production, so decrease protein synthesis. So this was all about the mechanism of the reversible cell injury. Hope you like this, and if we recall the things, so basically the cell injury can be divided into the reversible, irreversible, ER stage and free radical. In reversible type of cell injury, what will happen? If we remove the injurious stimulus, the cell will go back to its original state. What is the mechanism? The basic mechanism was the hypoxia that will lead to the decreased ATP production. So we can see three different mechanisms like sodium potassium ATPase, less pump activity, and second is lactic acidosis, and the third is detachment of the ribosome from endoplasmic reticulum.